Hello, everyone, and welcome to the third workshop in a 5-workshop series on leadership development titled Tell Me More About That, How Being Curious Makes You a Better Leader. In today's workshop, Lauren Harris from Harris Healthcare Consulting will talk to us about employee engagement and team building. This is a workshop, so we would love your participation. We also hope this gives you an opportunity to connect with other leaders across the state. Once the workshop series is complete, there will be an opportunity to schedule a one-on-one coaching session with Lauren. Just send me an email and I will get organized and make sure that you're scheduled. There are approximately 10 scholarships available for this one-on-one coaching session. So make sure that you guys reach out to me, and the Office of Rural Health can potentially pay for your session, which would be awesome. Lauren is passionate about medical practice and enjoys partnering with them to see them succeed. After years of honing her skills within large and small organizations of multiple specialties, including an RHC and school-based health centers, she started her own consulting practice in July of 2020. She partners directly with practitioners and leaders to provide business and operation expertise. Lauren started her healthcare management career in 1992 and achieved her MGMA CMPE certification in 2008 and her FACMPE certification in 2013. Before I begin, I have a few housekeeping details. This workshop webinar will be recorded. Eric Jordan will post the slides and the recording on the Office of Rural Health website within the next few days. Thank you to Eric, who is our tech support during the workshop. If you encounter technology problems, enter your questions into the chat box and he will assist you. You are all currently muted and can unmute yourself to speak. You can also enter your questions into the chat box. Your video can remain on or off. That's totally up to you. Lauren will be happy to answer questions at any time and welcomes your comments. Lauren, without further ado, the screen is yours.
Okay, great. And you can see my opening slide just fine today?
Yes.
Okay, great. Looks like we have kind of a small group, so I'm hoping that we can have a little bit of dialogue throughout this if you're comfortable sharing. So I may ask a few times through the presentation for your feedback and for you to share a little bit. So please feel free to do that. So today we're going to talk about employee engagement and team building. And we have 3 objectives today. The first one is to understand what employee engagement is and why it's important. The second one is to learn techniques to create high-performing teams. And the third one is to identify best practices for coaching and developing employees. So my hope for you today is that you will take away either a concept that you didn't know before or a tool. You'll see as we get through the slides that there are several takeaway items that I'm hoping you will find interesting and valuable for your day-to-day leadership roles. So first I want to talk to you about what is employee engagement and why does it even matter? So employee engagement is often used as a catch-all term, and really it can encompass everything from job satisfaction and motivation, productivity, and retention. And Gallup defines it as those employees who are involved in, enthusiastic about, and committed to their work and workplace. And we all want to be engaged and to work with engaged teams. I'm sure you agree. And the other thing I wanted to share that's important is that job satisfaction, productivity, patient safety, and employee retention can all be directly affected by an employee's level of engagement. And why I wanted to sort of stop on that patient safety comment for a moment is to say that if we don't have teams that are functional and working well together, the care that we provide for our patients can lack and we can drop the ball because we're not communicating well. We're not all working together to achieve the same goals. So having an engaged team is not just making a more fun place to work, but it's a more functional place to work. So what does engagement look like? Well, this is a piece of trash on the floor here in this picture. And an engaged employee sees that piece of trash, picks it up, throws it away. They feel like this is their home and their workplace, and they want to do they want to take care of it. They want to make it the best it can be for patients. An employee who's not engaged is going to walk right by that piece of trash. They're going to see it. They're not going to care about it. They're going to keep going. That actively disengaged employee, well, they're the ones that are throwing the trash on the floor. So you can see why we absolutely want to have more engaged employees in our group. And I really liked this graphic, so we're going to stop for just a second. This is Maslow's hierarchy of needs as applied to employee engagement. So if you've taken any basic psychology classes in your past, you've probably seen Maslow's hierarchy of needs. And I loved this because it shows you that the disengaged employees are really the ones that are just sort of in survival mode. And they're described as having low productivity. They just want to collect their paycheck. They are not satisfied or excited by work at all. Those are the ones that are just sort of the dead weight dragging the team down. The not engaged ones are a little bit better, but they're still just achieving really minimal productivity. They're the ones that are out more often than the others on sick days. They don't really like their team or their manager. They're not connected. Then you have another layer of employees who we call almost engaged, and they're productive, and they really feel like something bigger, but they're not outwardly proud of the work they do. They're not going to be the ones sharing in the community how excited they are to be part of your team. Then we have the engaged folks, and those are your high achievers, and they're really what you want to see as a vital part of your practice. They feel important in the role. They might feel busy and stressed at times, and they like the company, but they still might leave for a better offer. And then those rare ones are the highly engaged. These are the folks you probably have a few on your team, at least I hope you do, that are the high achievers. They're inspiring others. They're always finding ways to help others. They love working for the organization, and they're very proud of it. They're the first to recommend your organization if a friend or family member is looking for a place to work. So here's the good and the bad news. So employee engagement trends show that the percentage of employees who are engaged is going up. Even in 2020, during that crazy COVID year that we had, we have seen an increase of about 5%. So that's the great news. The bad news of this is that leaves another 60% of your workforce that is either not actively engaged or disengaged, walking by the trash or throwing the trash on the floor. So that's a little disappointing. Glad it's going up, but still not where we want it to be. So the question sometimes comes up of whose job is it to have it, to create a space for an engaged team? And I like this graphic because this was a survey done of HR professionals across all industries, across the entire country, and they reported what degree they feel that the following groups are responsible for the employee experience in their organization. So again, this is HR professionals reporting back. And 58% say that the employees themselves are the ones who are responsible. 64% said HR, 64% said immediate supervisors, and then 67% said top leadership. So really, many of us wear multiple hats in our organizations, and we're the top leadership. We might also be HR, and we're also the employees ourselves. So the takeaway from that is, if it's all our jobs, what do we do about it? And you're going to see me use this word a lot today, but I want to tell you that it's okay to ask. And in fact, it's the brave and vulnerable thing to do. And I'm going to give you some tools on how to have the right conversation. So there's several ways that we can measure engagement. You might do an annual survey, which is a comprehensive list of questions, and that would be at the larger organizational level. Sometimes we do pulse surveys where these can be follow-ups from the annual survey, where we want to know if the action that we're taking is causing any improvement or causing people's perceptions to change. Those are shorter, usually 5 to 10 targeted questions. You can also create focus groups, and this can be a really great tool to use if you have a very large organization, you're not sure how much data you want to collect, or even if you're just trying to get a little bit of the organization's team to tell you, are you headed in the right direction? For instance, if you're trying to answer a question about adding a service like an employee wellness plan or maybe a new benefit that you're considering, and you want to get feedback from different representatives of the organization, but maybe not survey the entire clinic or the entire practice. So focus groups can be very helpful for that. And Jenny Voigt, who is a representative, or she has a certification from SHRM, which is the Society for HR Management, says, don't ask every question under the sun. This is truly a case where fewer focused questions give you more than asking every question in the book. And in my career in the past, I worked for large organizations, and we have done very comprehensive, let's say, annual surveys that include pages and pages of questions. And not only are they frustrating for the employee, but they're frustrating for the leadership who has to sort through all of that data and really prioritize and triage which items are the most important. So when I say create an annual survey, I agree with Jenny in that it should be a smaller, manageable amount of data. And maybe you start with only 10 to 15 questions, and you think about what you're going to do with that information before you give it out. So a lot of people are afraid, and I get it. It's scary to ask for feedback. And when you're asking your employees for direct feedback, you might not be sure what they're going to ask for. So I thought I'd give you a little bit of comfort in knowing that typically the types of things that employees are asking for are things that you can influence and things that you can impact. So many times what they're saying is they really would like to have clear vision and goals, opportunities to learn and grow, a positive culture with no or very few toxic behaviors, trustworthy leadership, having a voice that's listened to, recognition, and then down at the bottom is compensation and benefit. And I'm going to stop for just a moment and ask for those who are on the call today, if you have any experience with doing these, and if you experienced the feedback coming from staff that what they really wanted wasn't just specifically compensation and benefits, but they were actually looking for other things. Does anyone have anything to add at this point? Yet? Okay. I think what I want you to take away, oh, here we go. Tamara said having a voice that's listened to is huge. Yeah, completely agree. Thank you. And I think a lot of organizations are afraid to ask because they think that everyone's going to ask for more money. And money's important, don't get me wrong. We need to have a livable wage, and we need to make sure that we are compensating employees fairly. But it's not really the most important thing that employees are looking for. Having that voice, having those opportunities to learn and grow, that's generally the feedback that we get when we ask. So don't be afraid to ask. So what does the process look like if you want to start doing this and you haven't been doing it yet, or even if you want to maybe do a smaller version, if your hospital system is doing this and you want to do something specific in your clinic? What you would do is prepare and design that survey, and again, being aware of how many questions you want to ask so that it is reasonable and doesn't give you more data than you can take action on. Then you want to communicate about the survey, let people know that it's coming, let them know that the expectation is that they will participate. Then you would implement the survey, analyze the survey data, and then do some action planning. So don't just ask for feedback, do something with it. In a 2018 survey, 59% of the HR executives admitted that their organization took no action or only the easy actions based on the employee engagement surveys. And I love this cartoon. We'll give you a moment to read it. Yeah, only 59%. So don't be this guy in the Dilbert cartoon where you ask for feedback and then it goes in the drawer and you ignore it. That is worse than not asking at all. People are expecting that we'll do something with that information and that we'll actually take steps to improve the workplace for them. This one made me laugh. Did it make anybody else laugh? Okay. So if you're thinking about how you would take the next steps after you've done the survey, you've gotten some feedback back from your team, this is a sample agenda for that action planning meeting. And I highly recommend that you set aside a very specific time for this. You can see this sample agenda is about 60 minutes. So rather than tucking it into an existing staff meeting where you only have 15 or 20 minutes, set aside the time that's needed to work on all of these things. It's important. And you want to demonstrate to your team that you also agree that it's important. So the first thing that I recommend doing is make sure that you thank your team for giving you the feedback, for being brave, for being vulnerable, and sharing how they're feeling. Let them know that this is an opportunity for everyone to continue to give that feedback as you develop your action plan. So you're going to pass out a sort of a worksheet or some information about the data that you received to give everyone perspective about what those gap areas are. And of course, these comments are generally blinded, so you're not going to have specific feedback from Julie or Steve or whoever else on the team, but you're hoping to collate it all so that you can really capture what the general themes are in the organization. And then you also want to look for those top areas of opportunity. So what is it that people are saying consistently? Lots of times when I talk to organizations, themes that pop up are the ones that we talked about earlier. So they would like to have a voice, or they would like to have more development opportunities. Occasionally we hear feedback about reducing the toxicity of a workplace, and that is valuable feedback. If your employees are willing to tell you that they don't feel like your workplace is a healthy one, you absolutely have to take action on that and resolve that. Again, thinking about not only the impact on your employees' lives, but also the impact that they're having on the patients that you're trying to take care of. So then you're going to develop some action items. And what this sample suggests is that you use small groups to share or generate some ideas for the top 3 or 4 areas of improvement. It's nice if you can have an employee champion who can work on this for you. What I'd like you to take away today is that this is not done in order to give the managers and the leaders one more thing to work on. The idea of employee engagement surveys is to continue that engagement, to continue making them part of the solution. So not only are they giving you the feedback about what needs to change, but then they're going to become the change agents themselves and be part of that. So also, you want to make sure that you revisit this information. So if you're going to have this type of a planning meeting, you're setting some very specific goals that you will look toward achieving, and then some check-in points, some touch points down the road where you're going to be doing either another pulse survey to get feedback, or you're going to be doing more regular one-on-ones and conversations with your team to see how they're feeling like the changes are being implemented. Any questions on this slide or what to do with the data if you get it, when you get it? Give you a moment. We're going to move on to concept number 2 then, which is I'd like to give you some techniques today to help you create high-performing teams. And really, what I want you to take away is that it starts with culture. And what is culture? Well, if you're intentional about how your employees experience your workplace, that is creating culture. And that means that that is what sets you apart from another place to work in town. Why would they want to be with you? Why would they want to take care of patients in your organization? And one way to create healthy culture is to reward teamwork and celebrate group successes. We are so great in healthcare about talking about problems. We're always diagnosing all day long. We're asking what's wrong and what's missing and how do we fix something, but we don't do a great job of celebrating successes or asking what's going well. So I would suggest that when you have a team success or an individual success even, that you put something on your calendar to remind you to come back and celebrate that at a future date. Remember those success points and share them again. Invest in your employees, and this can mean financially and emotionally. So It can mean paying for continuing education or inviting them to a workshop like this, or inviting them to do coaching, especially if you have a scholarship available. So what it says to employees is that you care about their professional and personal development. And when I say investing in them emotionally, what I mean is getting to know all of the members on your team personally. So you don't have to break down boundaries that you're not comfortable with or socialize necessarily at a level that you're not comfortable with, but it does mean that you know them as people and you know what's going on in their personal lives and you're checking in with them regularly. So you are invested in their success and in their health and wellness. So cultivate that trust by encouraging open, healthy, and candid communication. And I run into a lot of organizations where communication is not candid, and there is a lot of, let's say, meetings after the meeting or conversations behind people's backs. And I think as leaders, it's our job to set an example and not have those types of conversations with our team members. And also when we see them happening, to call them out. And we're going to talk in a minute a little bit about coaching, but what I want to say is if your employees give you feedback in the survey process that they feel that your organization has created an unhealthy workplace because of communication, take action on that. Get some tools, talk to coaches, read some books, be real with that, call it out when you see it, and encourage that trust that you can develop over time. So what does a high-performing team really look like? Well, they have a clear vision of their objectives and goals. They're enthusiastic about achieving their goals. They stay committed despite obstacles. So even when those speed bumps happen, they get over them. They act according to clearly defined priorities, so they know what they're supposed to be doing and they do it. They have good problem-solving skills. Oftentimes, they're great critical thinkers on their own and they can do this work without you. They manage conflict successfully. They are accountable. They share and exhibit leadership responsibilities and qualities. They maintain effective communication and healthy relationships with each other, like we talked about. They make group decisions, and they respect team processes and members. So I want to stop for just one moment and say, have you ever been a member of a really high-performing team, or are you now? And would you like to share anything about that?
Okay, I'll chime in.
Okay, thank you.
Our clinic went for quite a while without a director, and why we didn't have a director and things were put onto my shoulders as just a supervisor, I kind of developed a team of leaders, and when we did get a clinic director again, I encouraged her to always involve the leadership team that I had together that was helping me keep afloat, because there was so much that I don't know and so much that I had to learn, and I depended on them for all kinds of things. And so as our directors came on board, now she has included as a team rather than just her and I, it's a whole leadership team. And I think that they need to be recognized for all the extra energy and efforts that they put into keeping us successful. So, but that's what's going on in our...
That's exciting to hear. So did that make your employees feel more engaged, do you think?
It really does, and I think that keeping them involved has kept them really excited and thriving, because they know that their time with helping me wasn't just a short time and then off they go and they're not listened to anymore. Now they have input on their specific areas, and like they said, it's nice to be listened to, and they have a say, they have a voice, and when you have a few more voices that can listen to other voices, it really helps.
Yeah, absolutely. And as leaders, it's our job to grow our staff and to give them space to do things that maybe they haven't had the opportunity to do before. And you did that. That's exciting. So they're going to be the ones definitely that will pick up the trash on the floor. They're going to be the ones who care about the organization. And I love that you continued that with your new director and laid that cultural foundation that that's who you are, that's who your clinic is. Terrific. Thanks for sharing that. So how do you develop a high-performing team if you don't have one right now? Well, part of it is getting the team composition right and inviting the right people to the table. And some of this is when you're hiring, and some of this is also when you're thinking about within your organization, who are those team players that you want to elevate? Be aware of who's going to provide the best energy and the best input into the projects and things you're working on. So think about the composition when you're forming a team. And really focus on the team dynamics too. So if you formed a team within your team and they're not functioning as well as they could be, talk to them about the dynamics, talk to them about what the barriers might be and how they can work more effectively with one another. It's up to us as leaders to be that source of inspiration. So we are the cheerleaders a lot of times, and our job is to set the boundaries and set the goals and the vision, and then to get out of the way. So think about yourself as that source of inspiration and create trust. So do what you say you're going to do. Make sure that your team members are the same. Deliver the things you say you will deliver. And also work on building those interpersonal relationships to create trust and getting to know people. And then get out of the way. So let them really fly. Once you've seen that they can work together, that they know where they're headed, that they know what the shared goal and vision is, it's our job as leaders to get out of the way and let them achieve that. So what if some or all of your team is remote? And even before COVID, I worked with a lot of practices that had multiple sites. And so this concept of remote work or split teams or whatever you want to call it is not really a new one. And the things that stay the same and also have changed are our ability now to leverage technology. And I loved this graphic because it showed all of these super cool video meeting and chat apps and softwares available. And there's several on here I've never even heard of, but there's so much available now. A lot of it's built into the technology that you probably already have. Many of you have Microsoft, so you're using Microsoft Teams. Today we're using GoToMeeting. I happen to use a lot of Zoom. But even if you don't have any of those fancy technologies, pick up the phone. We still have phones. And I think we forget sometimes that a phone call is so much more connecting and valuable than just sending an email. So one thing that can be a struggle with remote teams is creating accountability. So I know I talked to a lot of leaders last year in March, April, where some of them were sending teams home, say from the billing office or other departments, and they were really worried, the leaders were, about how am I going to know if they're getting things done? How am I going to know that I can trust this person? So we talked a lot about creating clear and measurable goals so that everyone understands what is the expectation. Now that I can't see you down the hall and know exactly what you're working on, you have to be upfront about those expectations as well. So if in the instance of a business office employee, you've sent them home to work there and they're working remotely, be clear about when they need to be available on the phone or they need to be available for team meetings. Talk about these things up front so that they don't come up later as pain points or as things that we shy away from. And as leaders, this is always true. We need to be consistent. So we need to set these expectations. They need to be fair so that all employees know what's clear. And then we need to apply them consistently and create those metrics that we can follow up on. And at the same time, it's okay to be flexible. So in other words, if there are some positions or some roles that can be done in a different way or from a different chair or in a different office, be open to that possibility. I know there were some groups that took the medical assisting desktop type role where they were doing a lot of phone messages or returning patient calls, and moved those either physically out of the clinic if needed, or even into sort of a back office space where we could have some more social distance. But being flexible and open to what we can do to create safe space and to make our employees feel safe during this time is a big deal. And we still need to support our patient care goals. Key to that is creating a shared vision. So setting individual and team goals, and this is another part that I think we fail to talk about enough. It's not just what am I expecting from my individual employees as far as things they should be delivering, but I need to be looking at the bigger picture of my team and what are the team goals that we have, and then sharing that with them so that we are open and clearly communicating those pieces. It's very important also to connect our day-to-day work to the larger mission. So someone who may suddenly be in a more isolated space physically can have a harder time of understanding why their job is still important and what role they play with the larger picture of the clinic or the organization. So it's important to talk about the daily work that everyone does and how it connects to that larger mission. And create opportunities for ownership. So in other words, make sure that your employees have certain things that they're responsible for and that they can fully own and that they can celebrate when they go well. And here we go, define and celebrate success. So make sure that you're clear with your team about what success looks like and that you're celebrating that in a regular check-in type meeting. And again, revisiting those successes every so often. And this is key. So overcoming virtual distance by creating healthy relationships. So I wanted to give you some takeaways today of some icebreaker questions. And these can be used in person or on a Zoom call or whatever works for your team. But I was hoping maybe somebody would pick one in our meeting today and be brave enough to answer it in the chat or take yourself off mute. Somebody have a favorite here? Quiet bunch today. Okay, I'm going to pick on Rondi Ann. Will you answer me if I ask you your secret talent that few people know about?
No, but can I answer another one?
Yes, you can answer any of them.
Okay, so right now I'm working on a POC for a clinic, a plan of correction, after they've received a survey. And I have never had to complete one before because the clinics that I manage, thankfully, we never had deficiencies. And it's a learning experience. I'm enjoying every bit of it, but it's taken me longer than I thought it would, and it's definitely a great learning experience.
Wow, what would you share about that other people could learn from?
You want to be detailed and to the point and very articulate.
That's good to know. Yeah, thanks for sharing that. I love that you think it's a great learning experience, even though it's a little bit daunting.
Yeah.
And you know, the most rewarding things are, if you stop and think about it, nothing that's very rewarding was easy, right? It's always because we've accomplished something that we feel good about it. So good for you.
Yes, that's so true. That's how you learn and grow.
Yeah. So one of my favorite leadership folks that I've talked about before, Joe Mull, he calls these camaraderie questions. And basically the idea is that you're getting to know each other a little bit better. You're building a relationship. And you can do these again in person or on a video call, whatever's comfortable. It's a great 5-10 minute way to start a meeting. And especially if you have any remote employees, it can really bring people into the conversation. Here's a second set. So some more here. If anybody wants to pick one, you can feel free.
Come on, you guys. Somebody speak up.
I'll answer one of them.
Okay.
Let's see. My favorite comfort food right now, my favorite comfort food of all time, period, is Kraft macaroni and cheese.
Oh yeah, definitely.
It's got to be the Kraft macaroni and cheese, though.
Kraft only. Got it.
Yes.
No
Orange
generic
powder
brand.
all the way.
Orange powder. I love it. Yeah, that is absolutely an awesome comfort food. Yeah, that's cool. Anybody else have a favorite comfort food? Nobody's brave yet. Okay. Well, thanks, Missy. I appreciate you jumping in. All right. Well, I wanted to give you some links as well to some additional sites that have team building activities that maybe you haven't seen before. So here are three. We'll have the PowerPoint available as a PDF, so you can highlight and then put these into your search bar if you're looking for additional ideas. These can be done remotely and on site. There's just a lot of fun things here that will help you connect with your team more closely. So now we're going to move on to concept 3, which is identifying the best practices for coaching and developing employees. And this is a big topic, so it's hard for me to sort of narrow it down and pick my favorites. I hope that you get some takeaways from here that'll be maybe new and different than what you thought of before. The main thing that I want to share is that it's super important to start early. So prior to even recruiting for a position, getting clear about your organization's mission, vision, and values, which we've talked about in previous sessions, and defining your cultural norms so that you can, excuse me, you can sell your organization and you can find a good match when you're recruiting a new employee. So some groups actually create team charters or codes of conduct, which basically are documents that say how they agree to behave and treat one another as an organization. And those can be really powerful to share with potential employees. And during recruiting, make sure that you seek diverse backgrounds and experience. And we don't, I think, do enough to really be conscious about seeking this diversity. And I think what's happened too with the pandemic is we have sort of a different mix of potential employees than we've had before. One thing I've heard a lot is the hospitality industry has been hit very hard, and a lot of folks who were in food service or in hospitality and hotel management, things like that, they are now looking for additional jobs because those jobs don't exist or they're much smaller than they used to be. So look for employees that really have alignment with the overall vision for your organization, but they might not have the exact skill set that you were thinking that they need. So I want you to think outside the box a bit about those with customer service experience, those with other skills that would translate well into the roles that you're looking for. Obviously, that doesn't work well for nursing and medical assistants, but in a lot of other cases where we're thinking about patient service reps or even some of the healthcare coaching roles that I've seen, those can be filled by a lot of folks with diverse backgrounds and experiences. And then prior to onboarding the new employee, reinforce that culture by preparing for their arrival. There is something really welcoming about calling them a day or two ahead and just confirming with them how excited you are that they're going to be joining the team. Prepare some supplies and a workplace for them so that when they arrive, they have something tangible. Sometimes that means business cards. Sometimes that means just a little plant or something on their desk. And let your team know that they're coming with a virtual introduction so that they can anticipate their arrival. Did I see a chat pop up for a sec?
Best front office hires I've made without medical experience are baristas.
Definitely.
Awesome.
Yeah, Starbucks does an incredible job of training their employees in customer service. And I know a lot of the other coffee shops do too. So yeah, don't overlook those folks. And then during onboarding, be really intentional about planning their first day and their weeks. So assign them a work buddy or a team to partner with so that they have somebody to have lunch with, somebody to connect with, somebody that really makes them feel like they're part of the team and the family from that very first moment they land. So by find out how your employees like to be worked with. And again, there's that word again, ask. I don't think we do a good job of this in a lot of times too, about being really clear what works for people in the workplace. So I'm going to give you some suggestions here. Some questions you might ask about leveraging their strengths are, what type of work do you enjoy and do the best? What type of work do you enjoy the least? What causes frustration for you at work? And what occurred to me was, during this section we're going through right now, these questions are tremendous as part of the recruiting process too. So you can ask these early on to help define cultural fit, and then ask again when they arrive, or if you weren't the one to ask earlier, to get to know your employees a bit better. These are some great ones for leveraging their strengths. I love these about communication modes. So asking somebody directly, what's your preferred mode of communication? Email, phone, in person? This is a big deal too, especially for, I'm sorry for you, I didn't catch your name, who has the new director. When a new leader arrives that you're reporting to, if you're the one to ask them, how do you like to be communicated with? You're already going to get a gold star because that person may not have thought to tell you, hey, I am a email person, please don't text me, or I'm a text person, please don't email me. So let's be intentional about asking these of all of our new team members and new leaders that we work with. And this is a great one. What type of information do you want to receive on shared projects and assigned tasks? Some people want to be updated on everything every time there's a change. Other times people say, only give me the bullets, or only talk to me about that once a week. And asking somebody too, are you a big picture or a bullet person? Again, asking how they like to be communicated with will build rapport with that person right away and make sure that you are meeting their needs. And then of course, share yours at the same time. More here about communication frequency. So how often do you like to check in regarding your work progress? So weekly, bi-weekly, monthly? If you're onboarding a new employee, you may have already set those sort of milestones in place, that 30, 60, 90. But also, if you find out what feels comfortable to them, you can adjust your style to meet that. So some people don't want you to check in with them every week because then they'll feel like you're hovering or you're micromanaging. For other people, they need that regular feedback and they want to see you once a week or more. So asking, again, can help you really meet their needs. And sharing yours. So do you prefer scheduled appointments or impromptu conversations? That's a big one. Are they the drop-in and meet and greet person, or are they someone who says, nope, you need to be on my calendar because I have appointments back to back and I need to know when I'm talking to you? And I love this one too. If I need to interrupt you, how would you prefer I do so? Oh my gosh, for the physicians we work with, this is a tremendous question. Some doctors love being interrupted in the hallway and some don't. Some are really touchy about this. So it's super valuable to ask these questions up front. And then giving and receiving feedback. So when you have received helpful, constructive feedback in the past, how was it delivered? That's a great question. And what type of recognition is most meaningful to you? So when we think about recognition, everyone has a different way that they like to be recognized. Some people prefer public, some people prefer private, some people prefer emails. Other people say, if I got a coffee card once a year, I'd be happy. Other people need weekly affirmation. So knowing what works for the team that you work with is what we're going for here. So everyone's different, recognizing that diversity and honoring it. And then asking folks what their natural response is under stress. And when they're under stress, what do they need from you? So another way I've heard this question phrased is, how would I know if you're stressed? I love that too. So then I can tell if I see someone, in their office with the door shut, I know, okay, they're under some stress right now, not a good time to interrupt them. Where other leaders, they may say, I'm working on something, but I can be interrupted. So also valuable. And then this one too, just anything else that would be helpful for me to know about your preferences and expectations. These are, I hope, some maybe new ideas, new approaches that you might take. And you can do these at any time. It's not too late. Just because you have an established team or an established relationship with a leader in your organization, it's not too late to go back and ask some of these to build additional rapport. I want to talk for just a moment about a stay interview. And if you haven't heard that term before, what it really means is you're happy with the employee, they're delivering well for you and the organization. You don't want them to leave, you want them to stay. So the types of questions that you might ask those high performers and the folks that you really want to see stay in the organization are, what do you look forward to each day when you're commuting to work? You can also ask, what are you learning here? And why do you stay here? Just be upfront and ask that question. This is good too. When is the last time you thought about leaving and what prompted it? That will help you know if there's a change that you can make to retain this person before they think about leaving or before they think too seriously about leaving. And then also, what can I do to make working here better for you? And sometimes there are things we can change and sometimes there are things we can't. But you might be surprised. I have asked this question and gotten the simplest answers, and at least to me, what they seem like simple answers. A group I'm working with right now, I was talking with the front office team, and one said that her mouse hadn't worked well in a month. The other one told me that her keyboard had a dysfunctional key and she had to work around it. And to me, those are no-brainer, fix it immediately type problems. It's a $200 investment for these super fancy things that we need, but oh my gosh, the number of hours that we could relieve and stress and frustration for that employee who was just consistently struggling with that broken Apple keyboard, it was well worth the investment. So you might be surprised if you ask what little things they come back with as far as making working for you in your organization as great as it can be. So let's talk for a moment about coaching for a specific performance issue. And most of us have been through some training before about how to address specific performance issues, but I wanted to give you just a quick list here that you can reference back. Of course, we start with specifically describing what the issue is and explaining the impact it has on the team and others. And then what's key also is to get buy-in from the employee about the opportunity to improve. And I put this in all caps because you need to get agreement on what they are going to change, what actions the employee is going to take to resolve the problem. Again, it's not about you as the leader. It's about the employee changing what needs to be changed. And then you need to be clear about the consequences that will occur if that employee doesn't make the correction. And summarize and express support. And that can be as simple as saying, I know you're the right person for the job, or you are a valuable member of this team, or something that reinforces the relationship that you have and the fact that you value them as an employee and you want to see them be successful. And then, of course, documenting as appropriate. That's the biggest thing I see a lot is managers will have coaching conversations and they won't write them down. And that gets really tough if an employee continues that behavior or if there's a transition in leadership and that employee sort of continues that with that new leader and there's nothing to go back on to say that we spoke about this and that there were clear boundaries given about behaviors. So make sure that you document these conversations, that you're very clear in what the expectations are. And I love this saying too, which is being clear is being kind. So if you're having this conversation in the right way and you're being direct and you're being clear with the employee, that is the kindest thing you can do. The worst thing you can do is ignore the behavior and let them continue to show up in a way that's not good for them and not good for your clinic. So how do you prepare for some of these difficult conversations? Make sure that you've eaten within the last 2 or 3 hours or grab a little snack so that your brain is fully functional and energized. Take a little walk or at least several deep breaths before you're going to have this meeting. Make sure that you set aside enough time, that this isn't just a 5-minute conversation, that you've actually blocked enough of a break for yourself to have a meaningful dialogue with the person. Turn off all your notifications. So actually put your phone away. Don't keep it just here next to you. And prepare the space. And what I mean by that is don't have difficult conversations across a big desk. That immediately builds a barrier between you and the person that you're talking to. Those physical barriers They connote a power differential, whether you mean for it to or not. If you're seen as sitting behind the big desk when you're having these conversations, it feels top down. So I recommend moving your chair next to the other person. If you can have the conversation in a conference room where you can sit next to each other, it makes a big difference. It can take a lot of the tension out of the air early on rather than having it be across your desk. And then emotionally, prepare for the meeting. And one way to do that is you can do a brief little meditation if that works for you, or just think of something or a person or a place that brings you joy and makes you happy. There's a reason we say go to your happy place. It really does work. Listen to some music or look at a picture that makes you feel grounded. Maybe it's a family member or a pet or a place you've been. And visualize that this conversation is going to be successful and visualize that best possible outcome. So I want to talk for just a second about scheduling ongoing one-on-one coaching meetings. And this can be with your direct reports. So you might have a lead or someone that reports to you, or a supervisor, or even just line staff that you want to encourage and help grow up. And the reason for doing these types of meetings is because they, again, connect you personally. They build trust with you as a leader, and they strengthen those relationships. And all of that gives you leverage, I guess, to be able to ask for harder things. So if you need an employee to do something or to buy into a concept or to follow your vision, it's much easier if they trust you and you have a strong relationship. You can also use these coaching meetings as opportunities to inform and update and just give sort of what's happening now. We talked about that, I think, in another session of being transparent when you can about what's going on in the organization. And it's also an opportunity to provide mutual feedback for growth and improvement. So you can talk to them about what opportunities you see for them. They can talk to you about what opportunities they would like to see. And that can lead right into career development. And sometimes this means coaching someone on up out of the organization if they want to go back to nursing school or they want to grow into a role that you don't have. As scary as that is, a good leader will be the one to help them make those decisions and coach them through that. So here are some ideas for coaching questions you might ask during those one-on-ones. So what is important for us to discuss today? And it's an us conversation. It's about the two of you. And then ask them also to tell you about the biggest obstacle that they're having to success right now so that you can maybe remove it if possible. Ask what they're most proud of since the last meeting so that you can celebrate that again together. And ask about what they're most disappointed about so that you can support them through that. Maybe there's an additional resource or tool or person or something that they need to be able to accomplish their goals and to feel more successful. And ask also, what's the one thing I can do to help your performance? So again, it could be something simple. Maybe they need some technology that they don't have, or they need better training in something to feel more successful. And as Ronnie Ann was saying, this is a perfect segue. If your employee or your teammate has done something hard and gotten through it and felt good about it, that is an opportunity for you to celebrate with them and give them encouragement to do more hard things. And that helps us all grow. So just for a sec too, I want to talk about exit interviews. And these have sort of gone in and out of vogue over the years, but they can be valuable. So that means somebody's chosen to leave your organization and they've given you notice. And I don't recommend that you necessarily do an exit interview with everyone. If you know you have a disgruntled employee and you're not so sorry that they're leaving, then maybe that's not the right time to do an exit interview. But if you have that smart, trustworthy individual that you really wish would stay and they're leaving voluntarily, think about the opportunity you have to talk with them and get feedback from them. And the first thing is to really set a safe space for them and tell them that you want their candid feedback and that you're not angry with them and you're not going to hold their choice to leave against them. And then ask some questions like the ones below and make sure that you say thank you for them to having been candid with you and sharing this opportunity for you to make the organization better for the rest of the team members. So asking them a question like, what did you like best about working here? What did you like least? What should we be doing differently? What drove your decision to leave? And can I do anything for you? Trying to maintain those relationships and that support that you have given them as a leader, despite the fact that you're leaving an organization, can be really fulfilling for yourself and also meaningful for the person who's leaving. So I invite you to do that. So one other thought here, you may have heard about the 5 love languages, which came out from Gary Chapman, oh my gosh, 25, 30 years ago, a long time ago. There is a newer version called the 5 languages of appreciation in the workplace. And these are 4 of the 5. The 5th one talks about physical touch, which is a little bit more awkward, but I did want to share with you this link at the bottom, which has a languages of appreciation quiz related to these 4 items above. And if you take the quiz, you ask your team to take the quiz, you will learn a lot about what's important to them as far as showing appreciation. Another idea that I have seen work really well is, again, during the onboarding process, having just a small half sheet of questions, asking the employee things like how I like to be recognized, publicly or privately, email, in person, things like that. What's the best $5 gift card I would like to receive? What are my favorite colors or scents or flavors? You can also use those. One of the groups I worked with put them all in a big notebook and use them during Secret Santa time. So if you do Secret Santa in your practice, this is a great way to get to know people better too, and how to recognize them throughout the year. So here's another tool for you. So we've all heard of the Starbucks gift cards, right? Everybody loves those. I recently got a giftogram, which I had not seen before, so I wanted to share that with you. And what it allowed me to do was take the amount that the person had given me and spend it on a lot of different companies all at once. Starbucks was one, but there were a lot of others. So if you're looking for a way to share an actual e-card with somebody, or e-gift card, Giftogram is a good one. And then I've seen Karoo.com lately advertised a lot too for employee appreciation gifts. But the most important thing I wanted to share here is just to do something. And thank you cards, email, the sticky note on the monitor at the end of the day, a piece of candy. These all go a really long way in encouraging people and recognizing them. What I do recommend also is that you're specific. So instead of just saying thank you for being here, why? Make sure that they understand what they did right so that they can keep doing it. So if they handled an angry patient's complaint beautifully today, call that out so that they know next time that they should repeat that behavior. And the other thing I would like to share is, as you probably already know, many of these things really carry a heavier weight when they come from the physicians and other providers we work with. So I think it's our job as the leaders in our organization to encourage our physicians and practitioners to do these things as well, and to recognize the staff when they do something amazing, because no matter what, if the administrator or the manager thanks them, it definitely means something, and I'm saying do it. But if it comes from the doctor, oh my gosh, it goes up on the wall, it's kept forever, it's amazing. They have a lot of impact. That level of respect that our staff has for our practitioners is carried through in wanting to know that they are valued by them. So encourage them to do this as well. So just a quick plug here at the end for our next workshop, which will be on Thursday, March 11th. And we're going to be talking about resilience, relationships, compassion, and COVID. COVID kind of in parentheses, mostly about resilience, relationships, and compassion. So I'm excited to share some more ideas with you here in 2 more weeks. And I guess at the end here, we've come up just on an hour, but are there any questions or other bits of feedback people want to share? If not, I'll turn it back over to you, Rondia.
That was awesome. It really was. It was great, Lauren. Thank you.
You're welcome.
Thank you. Thank you for giving leaders this opportunity and time to learn and grow, because they don't get it very often. And so on behalf of the Oregon RHC leaders and myself, thank you. Thank you for this opportunity. It was awesome. Thank you everyone for attending today. Have a wonderful afternoon. And Lauren, did you have any last minute thoughts?
No, I guess I just hope that you found a tip or a tool or a takeaway in here that you didn't know before, or that you feel encouraged to be brave and ask questions that maybe you weren't sure were appropriate to ask before, and that you feel a little bit buoyed in your leadership role, and that you've got this. Because I think that's where we all need to come from sometimes. It's just that little boost of encouragement to say, yeah, we've got this and we can do this. So thanks for attending. I appreciate it, and I hope it's valuable.
Yes, thank you everyone. And remember, we have 10 scholarships. So if you want to have a one-on-one session with Lauren, please shoot me an email and I will get it organized for you. Thank you and have a wonderful day. Thank you, Lauren.
Thanks, everybody. Take care.